Welcome, everyone. We are pleased to welcome you to this coffee and chai chat. And my name is Martin Mwangi. I'm the program lead of the Healthy Mothers, Healthy Babies Consortium, which is hosted by the Micronutrient Forum. We intimately call it the HMHP. And so the HMHP Consortium aims to drive collective action for improving maternal nutrition, and specifically to accelerate the introduction of multiple micronutrient supplements in settings where diets are poor and the indicators such as anemia and low birth weight among pregnant mothers especially are high. So multiple micronutrient supplementation can have a significant impact and improvement in maternal nutrition. And can also result in the well-being of mothers, especially in this kind of settings, being greatly improved. And that's the reason why we are focused on it. Now, before I introduce today's guests, I would like to quickly take you through the format of today's chat. Our guest speakers will give a short introduction about their topics, and then during their presentation, we will request you to mute your mics or mute them ourselves. After their presentation, we will unmute you so that you can ask your question and carry the discussion forward. Now, we prefer that you type your question in the chat section, but you may also ask your question directly to any of the speakers. And during the question and answer session, we request that you keep yourself muted and raise your hand when you want to ask a question. There is a small section where you can click an icon and your hand will be raised, and that will flag us to ask you your question. Once you're called upon to speak, please unmute yourself, and again, mute yourself when you are done with your question and your conversation with the speakers. And this will help avoid background noise, which might interfere with the discussion. We also request that you write your name and organization in your Zoom window so that we can invite you and speak to you by your name. And if you notice that your name has somebody else also, you have somebody who you share a name, maybe make it more, add your second name so that there's no confusion. Please briefly introduce yourself when you ask your question, maybe your work-related information and whether you have worked with MMS. That might also help frame the question. And please note that we have a very strict 30 minutes chat session, and would really like to give everybody who is interested a chance to speak, to be a part of the discussion. Therefore, we request your cooperation in keeping your questions short, precise, and to the point, and so that we can move on to the other questions in the chat. If you have any technical difficulties, please type in the chat, and our technical team will immediately get in touch with you. So, without more delay, I would like to introduce the first guest. And our guest today comes all the way from West Africa in Mali. Dr. Ouassa Sanogo is the Deputy Country Director of Helen Keller International and in Mali, and she has more than 15 years of experience managing maternal and child health and nutrition programs, and a very good knowledge of the Malian health system, including experience working with government, bilateral and multilateral partners, and civil society organizations. Now, Dr. Sanogo works with many health and nutrition stakeholders and related ministries in Mali. Today, Dr. Ouassa Sanogo will speak about the Malian experience of introducing multiple micronutrient supplementation during pregnancy. And she will tell us, for example, whether the toolkit we are about to launch today would be useful in Mali, and in how she would use it. Ouassa, I'm delighted that you have joined us today, and I'm really looking forward to a stimulating discussion. And I now invite you to, introduce yourself to the audience and maybe to say a few words. The floor is yours.
Okay, thank you, Martin. Morning and or after greeting all the participants. As Martin said, I'm Ouassa Sanogo from Mali. I'm the Deputy Director from Helen Keller, Mali, and I'm very happy to be here with you.
Thank you, Ouassa. Our second guest today is Dr. Tanuja Rastogi. She's the Director of Advocacy and Communications at the Micronutrient Forum. Tanuja has over 20 years of international development and partnership experience which is backed up with by a doctorate in nutrition epidemiology from Harvard School of Public Health, and then followed up by over 14 years at the United Nations World Food Program at the nexus of evidence, programs, policy, and advocacy. Now, the main question today is how to advocate for multiple micronutrient supplementation. And we are very lucky to have such an advocate to tell us how we can go about this. So Tanuja, the floor is yours to introduce yourself.
Thank you so much. I'm pleased to be here and look forward to the discussion.
Great. Maybe you can also kick it off with your slides on advocacy, and then following your slides, I will take over and introduce the toolkit, and then we can start the chat.
Great. The first slide, please. Thank you so much. So at the Micronutrient Forum, we fundamentally believe that knowledge without action is insufficient. And so we have made advocacy one of our 4 strategic objectives in our strategic plan from 2022 to 2025. And with our aim to increase global awareness on priorities in micronutrient malnutrition. And we do this by working with partners to generate policy relevant evidence to drive evidence-based policies. And our ultimate goal is to increase investments and actions for micronutrient initiatives and programs. We have our targets are decision makers, policymakers, funders, and implementers of programs. Next slide. So understanding advocacy. First, what is advocacy? But first we should know what is not advocacy. And so simply doing general communications about your organization or your work is not advocacy. And also simply doing activities in isolation is not advocacy. Strategic communications is a tactic to do advocacy. So advocacy is a strategy you develop. It is a deliberate process of influencing those who can make decisions about developing, changing, and implementing policy. It clearly is a key tool for us as a global community, a development community, health community, food security community, to engage and mobilize governments in achieving the Sustainable Development Goals. And advocacy involves delivering evidence-based recommendations to decision makers. Next slide. So for any sustainable change in policy, it's important to move again beyond these sporadic and isolated efforts to a strategic approach and carefully planned advocacy strategy. Just like any other project implementation or other effort, we need to clearly outline and articulate what is the problem statement that you're trying to address. What are your goals and objectives? Who are your targets? What are the key messages tailored to the various targets? How do you implement and coordinate? Who are your partners? And then it's really important to be able to monitor and evaluate the progress you have achieved or have not achieved and why. Next slide. So today is really an introduction to advocacy. This is such an important topic for us, but I want to make sure that we come out with a clear understanding of just 3 simple questions. What is the goal of your advocacy agenda? Meaning, what is the policy? What are the policies needed to be created and changed to impact the problem statement? And then it should also specify what the advocacy initiative should ultimately accomplish. And like any other project, you need to make sure the goal is SMART. It's specific, it's measurable, it's achievable, it's realistic, and it's time bound. The next really high level question you should be able to address is, who is your target group? So of course, we all are aiming to influence decision makers in ministries of health, but also you may think about who influences the Ministry of Health decision makers. Is it the finance ministry officials? And so then that will help you decide what are the messages, what's the types of information and data that would influence that. And in addition, who are the influencers to those decision makers? Is it a groups of academics in your local community? Are it mothers groups in communities at the subnational level? Is it various social cultural groups, religious groups? We need to engage these various groups along our journey with our advocacy plans. And then last, what is the information that is needed to influence these decision makers? And so, of course, we want to make sure we have the evidence and the right information tailored to the way that target group consumes the information. So we may have lots of scientific journals and research. We need to be able to translate that in a way that our audience members can absorb it. And with that, I'm going to hand it back to Martin and to Ouassa to talk about the advocacy toolkit. Thank you so much.
Now, thank you, Tanuja. I will quickly take you through the next 5 minutes on and introduce to you the advocacy toolkit that has been developed by the Healthy Mothers, Healthy Babies Consortium. And I will start by also saying that the Healthy Mothers, Healthy Babies Consortium is a consortium of over 90 organizations and individuals who have collectively come together to advocate for the health of mothers and their babies. And so one of the needs that was identified is the need for there is a need for a well-curated, well-developed science and evidence-based toolkit that our national actors can use to advocate for multiple micronutrient supplementation. So the question is why, and do we need this toolkit? And the truth is, at the moment, most countries are still having iron and folic acid as a program in the antenatal care centers, in their health centers. Unfortunately, only 38% of women receive 90 or more iron and folic acid tablets during their pregnancy, which is actually the minimum recommendation. And only 59% of pregnant women attend 4 antenatal care visits. And you will recall that since 2016, the World Health Organization now recommends that pregnant women must at least meet the antenatal care clinic personnel for at least 8 times. And therefore, this increases the gap of, the contact points are way fewer than recommended. Each year, we have over 20 million babies being born with low birth weight. And we know low birth weight is one of the markers of poor maternal and fetal nutrition. And then we have tragedies that have happened, COVID-19, which has led to worsening access to quality diets and services, and is decreasing is leading to worst case scenarios when it comes to the statistics that got to do with mothers and their babies. We have wars happening. We have climate change also happening. And so, for example, if I zoom in on the COVID-19 pandemic, it has already compounded the problem. And so far, the Standing Together for Nutrition program, which is also one of the programs under the Micronutrient Forum, they estimate that with the COVID-19 pandemic alone will result in an additional 283,000 child deaths over the next 3 years, which translates to around 250 child deaths per day. 13.6 million wasted children and with a high risk of death, and then 3.6 million children with lifelong physical and cognitive impairments due to stunting, and an additional 4.8 million more women afflicted with anemia. And so this tells you why we cannot sit down and not advocate for the health of mothers and babies, especially at country level. And then the next question you probably will ask me is then why MMS and what is MMS? Now, the United Nations International Multiple Micronutrient Antenatal Preparation of Multiple Micronutrient Supplements. Now, that's the name it's given. That's not my name. It's called UNIMAP MMS, but for ease of conversation, let's just call it MMS going forward. This is an antenatal supplement for pregnant women, and it contains 15 essential vitamins and minerals for pregnant and nursing women and meets micronutrient requirements that poor diets really cannot meet. iron and folic acid that has traditionally, and that most countries usually roll out, has only these two, that is folic acid and iron, included in in the composition. What we are saying is that WHO already now recommends MMS, and it has already been found to be effective. It is safe, it is affordable, and it's also cost effective at country level. And the recommended dietary allowance for MMS is just one tablet per day, which is the same for women in USA and Canada. So really, it's not a very difficult intervention to give, because it's comparatively, it's just like IFA, but with more micronutrients, vitamins and minerals. The toolkit that we are launching today has 4 major components. But the first one, which is actually a PowerPoint presentation, which is adaptable and which can be used to advance multiple micronutrient supplementation at a country level, is where the focus mainly is. We have 6 modules in the PowerPoint presentation. And these modules are designed such that the user can actually pick, cherry pick whatever you need, and go to a meeting and use it to present it and use it to advocate for MMS. It can also be that you just need to adapt it. So they are also adaptable. You can just quickly download the PowerPoint, adapt it, and use it for your presentation. And then, and I'll come back to this slightly later. For now, I want to say that we also have added 3 other documents that you might need for your meetings, or for your conferences, or for your briefings with community members. So we have one, which is a MMS advocacy brief. And this one gives everything from the global scope of maternal malnutrition, going all the way to why you need MMS. Is it safe? Is it affordable? Is it cost effective? And how can it be implemented at local level? We have another one, which is actually a frequently asked questions on MMS. We have noticed over time there are questions that keep coming back, and therefore we just compile them in a frequently asked questions brief, which you can then use to familiarize yourself with which questions might you expect and what might be the answers. But you could also give it as a flyer to the stakeholders at your meeting, whether you are meeting a government official, whether you are meeting your students at the university or at the colleges or at nursing schools, whether you are meeting implementers of programs at NGO level, or whether you are meeting even chiefs or even traditional leaders who just have questions about MMS. The other one is obviously a question that might come, like, where did you get that material? And that's from Healthy Mothers, Healthy Babies. And that can now tell you about the consortium of members and why, or the approach we use and why we develop the fact sheets, and then you can know how to answer them. Now, let me point out that this toolkit is also being translated into French and Spanish, and we look into also translating it to Arabic so that all users worldwide can be able to use them. So just 2 slides to explain to you how you might be able to use the PowerPoint presentation. So please use the PowerPoint presentation, which has over 60 slides, to facilitate your dialogue and create a consensus around MMS. So this is really a resource for anyone wanting to communicate the evidence and benefits of MMS. And therefore, you should feel free to go to the HMHB website and download it, save it in your computer, and periodically or adapt it to your country. You can use local data, local statistics to adapt it. But some sections are about global information, so you don't need to change those. So it's really an adaptable resource for you to use. You can also customize the dialogue about surrounding MMS and make it relevant for your audience. So what you can do is that you will note that in each of the modules, there are parts where you can add your own words so that you can make it, like you can also add your own speaking notes so that you make it more relevant for your audience. And if it's in French, you can add your speaking notes in French. If it's in Spanish, the same thing. If it's in English, the same thing. And also remember that one of the questions that is going to keep coming back is about, okay, is it really worth it to invest in this at country level? What is the budget? Does it have an investment case for our country? If I take a country, for example, like Malawi or even Kenya or even Mali, government officers might want to know, have you tailored these to our country level statistics and data? And yes, in the PowerPoint presentation, there is somewhere you can use a tool, plug in your country level data, for example, population data, and then you will get very specific details about your country, and you can therefore use that data for advocacy at your own country level. So who are we targeting with this advocacy toolkit? So first, it's advocates and public health professionals. If you know at any time that you usually advocate for maternal health and you have been looking for a presentation that you can quickly use, adapt and use, then this is a toolkit for you. And for example, the PowerPoint presentation for you, you can use all the modules A to E. It's your choice. Also, we have national health officials and non-governmental organizations who usually want to, for example, advocate for increased budget to the nutrition department, or approval for certain programs, including rolling out and scaling up MMS programs. Then you can use this PowerPoint presentation and all the modules will be relevant to you. We also have, as a micronutrient forum, but also some of the consortium members at HMHB are from academia and research partners. They also can use this either to teach about MMS to their students, but also for writing grant proposal, presenting about this, but also for advocating for MMS in their own countries. So modules B to D might be very useful for you in this case. And also we have for local providers and distributors. So in summary, why this toolkit? We want to facilitate dialogue, create consensus, customize the MMS dialogue, and adapt this communication to your audience at your country level, whatever you might be joining us from. What kind of topics can you find in these toolkits? You will find things about pregnancy and nutrition, about maternal malnutrition, the scale and scope of this in your country, but also globally. Evidence on maternal malnutrition supplementation, national impact, and whether MMS is a good investment case for your country, how to introduce and scale up MMS in your country. And we have even added a case study on Indonesia, where we have walked you through how Indonesia could use this toolkit to advocate for MMS in Indonesia. So, as I said, for health officials, public health professionals, researchers, academia, local producers, providers, and distributors of MMS, everybody can use this toolkit. So I will pause there and I will stop sharing my slides so that we can go into plenary and have an interesting discussion now. At this point, I want to welcome Ouassa to join us and Tanuja also in plenary so that we can start our conversation. So maybe I start with Ouassa and I can ask the first question. So Ouassa, what are the key arguments or challenges maternal health experts want to see addressed in Mali, especially when it comes to MMS?
Okay, thank you, Martin. Although the coverage of IFA in Mali is quite high, about 80%, 87% of women who go to antenatal care receive the prescription of IFA. But we know 28% of women only say on the report that they take the IFA, really take the IFA. Our challenge is how to increase the coverage of MMS. When we are doing the shift IFA to MMS, one of the challenge is to increase the coverage of MMS. And then, as Ellen Keller in Mali, we are starting with the discussion of the Ministry of Health to set up a pilot to assess the feasibility of the shift IFA to MMS. And then I think this tool is come at the right moment for us, because as I say, we are at the starting in Mali. We are starting in Mali. We can use this as a advocacy tool but also as a tool to increase the awareness of health workers among health workers at all the health centers. I see the tool. I see the tool, and what I can say, the tool is very useful for us because it's we can save money because we are not try to do our tool to advocate for Malian government, and also we can save time with this tool. I think in the tool, all thing is already done, and we just take it and use it. But as I say, we need also some more evidence from African countries. And like you say, it's already, Martin, we need also the tool in French. Thank you.
Thank you very much, Ouassa. And maybe if you don't mind, if I can push you a little bit further with an extra question also. I'm curious, what currently is your advocacy approach in Mali? Because I know you have explained to me in the past during our chats that you are busy trying to transition from IFA, iron folic acid, to MMS. But could you maybe talk to our audience and tell them how you have done that? Have you done any advocacy, and what approach have you used?
As I said, you just started to work in the MMS area in Mali. You already met the head of the key departments who are involved in MMS. And for our next session, I think we must use the tool. We have choice the adapted parts of the tool for this audience. We have choose about in compare with the audience, and we can choose parts of the advocacy tool to use with the authorities. It depends on our audience. If it is the chief of the department, we can take some part of evidence for them. If it is also the health worker, I think we have some part of the tool which can be useful for us. I think the tool is modulable, and we have also many documents who accompany the tool, and we can use it also to adapt and to put it our information. Our country information to adapt the tool well for our context.
I like what you said, because at the end of the day, we have different users. You know, some people are organizations from, you know, NGOs, INGOs. Some people are from government. Some people from academia. And so for me personally, it is going to be very interesting to see the different formats in which people will use this to advocate for MMS. I don't know, Tanuja, maybe I can poke you a bit, because there is you mentioned something very interesting about effective advocacy, goal, target, and information. Now, I wonder, what strategies do you suggest that people listening can use to nudge policymakers? Is providing information enough? Because now this is a toolkit with information, but is it? How can they use it?
Yeah, how can they use it? So so the tools, I just want to say, the advocacy toolkit, it's not a single organization tool. And I think the power of advocacy, it's the power of collective action. And so I think probably one a key message I could leave here is partnerships and coalition building. And so we speak stronger when we speak together. And so a great step forward would be, you have your goal, you have your targets. You know, again, it's the decision makers, it's the funders and the implementers. And then your tactics, right? So the tactics could be also, let's bring together the local academic experts with the decision makers, or with the NGO actors in the ground, the civil society advocates. What would be nice is what decision makers want is information that they can use, that's usable. So packaging informations in clear language, a call to action. where you have multiple stakeholders who influence those decision makers sign on. Perhaps having the collective group use this information in the advocacy toolkit, the key messages in particular, to write a letter to national ministries of planning, the coordinator, supporting, if there is one, a son coordinator in the government, or writing a letter to the prime minister or president, talking about why this issue is so important to the future. I think another important tactic is the economic case. Investment in MMS will produce life savings, but also the economic productivity of future generations. And that we have seen time and time again is a very powerful influencer, particularly when you engage the ministries of finance. The ministries of health, of course, will say, we would love to do everything you are saying, but we need to make the case to my counterpart in the finance ministry so they can allocate the budget. So I think be very tactical and taking the science as well as the economic science as well.
Thank you, Tanuja. So ladies and gentlemen, we are 1 minute above time. There's a question that has come for Ouassa and also Tanuja and others. I will maybe possibly ask only one last question to Ouassa, and then we have to close. So Ouassa, there is a question that I think is important here about how important are international guidelines, for example, from the World Health Organization, UNICEF, and others, other normative agencies for shaping national policies in Mali, in your experience? And does Helen Keller International recommend that we spend more advocacy effort on national governments, the international community, or both equally? Maybe the first part about the importance of guidelines from normative agencies. And as you speak to that, maybe I can also open a slide about these guidelines.
I think we need to put the effort on both the two, government and also the international organization. But government, especially because my feeling is that they need many evidence. There are many requests for evidence of why we do this shift to IFA to MMS. Also, I think evidence from similar countries are very important. I can say also WHO and the other international government, because they are very listening by our government. If WHO is very engaged for the shift IFA to MMS, I think our governments, our authorities also can be engaged and so on. But in Mali, in our case, we have no resistance for this. The authorities we already met are very enthusiastic, very open to do this shift. But now we need to work with them to how to step, how to do the right thing, to scaling up and things like that.
Perfect. Thank you very much, Ouassa. And I've just put up this slide here for the consumption or the view for the audience to view. So MMS has already received a lot of guidance and for various contexts, you know, during for patients with tuberculosis, for example, in emergency situations, it is now included the essential World Health Organization essential medicines list. And for the WHO calls for the scaling up of MMS in the context of rigorous research. And that's the reason why we brought on board Ouassa to tell us, in the case of Mali, for example, what are they doing about this issue? Now, this is a very interesting conversation, ladies and gentlemen, but unfortunately, we have to bring it to a close. And I apologize for the extra 4 minutes that I have taken. Please stay tuned for the future coffee and chai chats that we'll be hosting as a Healthy Mothers, Healthy Babies Consortium. And if, as you use the toolkit, if you come up with suggestions or, you know, for improvement or anything that you think you can communicate to us, I think our team has posted there our contact address. Feel free to use it to join us. Lastly, thank you so much for joining us today, for giving us your time, and we look forward to engaging you in the future. And thank you very much to our panelists, Tanuja and Sanogo. All right, bye-bye for now.
Thank you, bye-bye.